again about what we do at Health Hub. And but before I even do that, I'm going to talk about Health Hub. Health Hub, we are a nonprofit and we're exclusively affiliated with UCSF. We are 100% supported by the venture capital community. So we're not directly a part of the University of California. All of us are volunteers. We're doing this because we love healthcare, and our goal is to help companies scale and grow. When we set up Health Hub as an innovation center, we said, what does Silicon Valley need? When we felt Silicon Valley needed basically just a way to take advantage of the amazing resources of UCSF, UCSF being the center of healthcare innovation. And what we end up doing at Health Hub is we introduce companies to mentors, we introduce companies to investors, we introduce companies to clinicians, doctors, and to hospital administrators, and vice versa. My day job is I'm a venture capitalist, and I'm a venture capitalist at a firm called Builders. I've invested in healthcare now for quite a few years, and my background is a founder as entrepreneur. And you know what I found as a founder and entrepreneur is all the help that I could get from great people around the world that could help me scale and grow whatever I was doing was great news. And that was one of our inspirations in starting Health Hub. We always want to start this as a huge thanks to our sponsors. So we have today, Wilson Sonsini is our primary sponsor for all of this event. Silicon Valley Bank, we want to do a shout out to. Livongo, which was one of our winners last year, is a key sponsor, and as is UCSF Innovation Ventures. And here are some of the venture firms that are behind us and are really paying the bills and going to really support what is going to be a fantastic grand finale on the 23rd. So thanks to all of our sponsors. So I want to take a step back and talk about what got us here at the awards event and what we've done and why we're about to honor today's companies. We went through actually quite a very, very considered process to getting to these quarterfinalists. How do we do it? Well, since we ran an awards program last year, and last year we had almost 500 submissions, we learned a lot. And we were able to honor what we thought were some of the, truly the greatest companies. Well, this year with COVID, we weren't able to have a great physical event, which is what we did last year, where we had 500 or 600 people at our campus in Mission Bay. We've decided to bring it all online and bring it online in a very big way. Well, the first part of throwing a great awards event is making sure that you're going to award the right companies and to put a lot of intentionality and thought into what makes a company great. So we ended up coming up with 15 different categories, and our categories were put together by a team of practitioners at UCSF and about 25 venture capitalists that we all sat down and we said, what are the most important categories in digital health that would basically allow us to honor the industry and honor the right companies? So today you're going to see 3 of those categories discussed in the quarterfinals. We ended up getting, and well, let's just go back a little bit here. We ended up getting 750 submissions, and that is a lot of company submissions. So we're now down to approximately 130 of the companies in the quarterfinalists. These were all amazing companies. We have been blown away by the progress that we've seen in the last year in the digital health arena, and we all know why. This is basically digital health is having its e-commerce moment. It's breaking out. The same thing we saw in retail with Amazon and for those who have, and I'm one of them, to live the web, the early .com days. We're seeing the same thing in digital health, and wow, what a rush it all is! And you guys are riding the wave. 750 submissions is a lot of amazing submissions. We've been working on this now for 6 months. There are 3 rounds in this program. This is the first cut, which is the quarterfinalist round, and it's the hardest cut. We then have a semifinal round, and then we have a final round. There are 250 judges doing the judging in this process. The judges not only are from UCSF and not only are venture capitalists, they're coming from Cleveland Clinic and from Mayo and from Cedars Mount Sinai and Mount Sinai, other great hospital systems. They are analysts, they are pundits, they are bloggers, they are people that know digital health. We went out and we said, who are the 250 people that we thought mattered? And they've all volunteered, and you see them listed as judges. And so, you know, again, these are awards that are being presented by people that are hypothetically in the know in the community. And so the company should be really feeling great about this. So what's our criteria? Well, our criteria for this round, there were 100 points given, and they were basically given over these 8 categories. So 10 points were given to companies, and we said, what's the scope of the problem that these companies are solving? Obviously, a 10 means they're solving a huge problem. A 2, maybe less so. So judges gave a score from 1 to 10. What's the level of innovation? How innovative is this company? How innovative is the technology? What are they doing? Are they fast followers, or are they the real deal? Third, clinical outcomes. Let's make sure that the company has what they said they have. This is really important because the output of this is a list and an outreach that we're going to be doing to hospital systems around the country. And we want to make sure that the companies and the solutions we're recommending are ready to be bought, ready to be deployed. So show me that the company has clinical outcomes. Show me the company has customer validation. And we actually give a double score to this, customer validation. We wanted to make sure that your customers using this product, they're loving this product, they're feeling good about this product. And if that wasn't the case, maybe it's come back next year to our next year's awards, then you'll be ready. Same thing with market traction. We double valued this. We wanted to make sure you were really in market, that we could count the tens of hundreds or millions of people that are really using your product. The more, the merrier. Of course, if you were focusing on a rare disease, you don't need millions of people, but market traction is important. Ease of use is important. It's really important that patients, clinicians, and we don't need just IT professionals using product. Cost savings, we all want to reduce the cost of healthcare. So what was this solution doing relative to sort of stripping some of the costs out of healthcare? And finally, it was level of differentiation. Is this product really different? Does this product matter? And that was all really important. These were our criteria. So, with that, today we're really lucky to have Dr. Craig Monroe join us, and Craig is going to be announcing the quarterfinalists today. Craig recently joined UCSF, and he is the Associate Chief of Clinical Innovation in the GI division. He's also the Assistant Professor of Clinical X, which is, we'll let him explain what that is at UCSF. And he comes to us from Kaiser. He spent a number of years from Kaiser where he ran the gastroenterology group at Kaiser Permanente in San Francisco. He's a member of the UCSF Center of Digital Health Innovation, which is CDHI, and he's a member of the San Francisco Academy of Medical Educators. UCSF was ecstatic to recruit Craig, and he's just started this week. And with that, Craig, I'm going to introduce you.
Excellent. Thank you, Mark. Everyone can hear me? All right, good. So yeah, as Mark said, recently joined UCSF, and I'm really glad to be here with you guys. Definitely a digital health enthusiast, and obviously as a practicing clinician, this is all stuff that is very important to me and hits close to home. And Mark didn't say it, but because Mark Goldstein likes me better than the other judges, he actually gave me the best companies and categories to present. So he left that out of his little spiel there, but we'll give him a break on that. So I'm excited to really announce 3 categories. The first one is new applications of COVID. The second one is mental and behavioral health, and the third one is patient cost savings. And so, I want to first say that these are the most important challenges facing our world today. And so just off the bat, I want to congratulate all of you for working to solve these problems. These are the problems of our time. And so out of the ashes of this pandemic, we're really seeing an explosion of innovation, and everyone here is on the leading edge of this. And so I'm just going to take a couple more minutes. I don't want to take too much of your guys' time. Let's get to the action, but I just want to say why these categories are important. So first, COVID. I'm in the hospital now, and it's scary times for clinicians, and not just doctors, nurses, medical assistants, everyone who has to go into work and not work remotely. As a clinician, seeing patients, it's clear COVID is here to stay. And most, unfortunately, most really haven't started to consider the long-term consequences of the virus. So we need people like you to help solve these problems. The second one is mental health. And the mental health crisis existed pre-COVID. Mark, I'm gonna forgive me for using the S word, but my wife is a psychiatrist at Stanford. And so before COVID, it was clear there was not enough appointments to take care of our population's mental health issues um, before this all started. And now that we have a pandemic of mental health on top of the pandemic of COVID, it's even more of an issue. If any Stanford people out there, you know, we're not going to necessarily hold that against you. The third thing is cost savings, and this is the elephant in the room. Without solving this problem, nothing goes forward. So, so just wanted to congratulate you all again for the fantastic work you've been doing. With that being said, let's get to announcing the quarterfinalists.
Great. Well, we're going to end with COVID. We're going to start with the best patient cost savings companies. And this is, this really is a super important category. And so how do we define it? And how did these companies end up being our quarterfinalists? Well, our definition was the best new digital health product or service that's helping patients and providers save money. You know, Craig said it well. If we don't strip costs and we don't strip money out of the system here, we're in trouble. One might argue that this award is increasingly important with COVID, but look, healthcare costs were going up 15% a year. This was all we were talking about before COVID hit, was the fact that healthcare costs were out of control. What were we going to do? 22% of our GDP, unsustainable for a prospering nation to sustain or, you know, and really to remain dominant. This was, you know, as Craig mentioned, the elephant in the room. Well, digital health is really the solution. I think everyone here knows this. Sure, we're going to continue to hopefully get better vaccines that hopefully will cost less, and various pill-based therapies. But it's really going to be the digital side of things that puts a brake on the cost uptick. And we've really seen it. Thank God for, you know, for telehealth solutions. Thank God for RPM today. If we didn't have these, and you know, imagine the cost to our hospital systems and how we would basically have addressed some of the situations with COVID. Well, today's companies are those that are here really on the bleeding edge of all this, and they've applied AI and workflow and new types of content that we didn't know existed, or come up with some really incredible tricks or super clever ways to help patients save money. And this is really important. Craig, what would you add to this?
I think you hit it all. Absolutely. Nothing to add from my point, Mark.
Well, there it is. Well, who was our winner last year? So our last year winner was a great winner. It was Grand Rounds. And Grand Rounds has obviously had an incredible year. They've not only in terms of raising as much money as they could possibly ever need, but they've reached across now and touching literally millions of patients. And you know, they are making a difference, and they did make a difference. And we were really proud to award the entire Grand Rounds team in Mission Bay last year. But for this year, and Craig, I'm going to turn it over to you to announce the quarterfinalists for this year.
All righty. So first quarterfinalist, Taylor Med. Next, Single Care. Vinca. Wealth. Also VR. Sword Health. Alpha Health. Advocacia. Carum Health. Innovasa. Informatica. Notable.
So look, congratulations, guys. This is, we had in this category alone, there were 70 or 80 different companies that applied. We actually had to sort of judge it twice. You guys all deserved, you know, to be a quarterfinalist, and you know, the journey is beginning, and you know, these are mind-blowing applications and mind-blowing solutions. And you know, thank God, I think everyone is saying you guys are here, and the future of healthcare is, you know, is going to be somewhat under control. So once again, congratulations. We're going to go into a breakout session later, where all those who are interested in focusing on the patient cost savings companies can hear directly from the companies and from the CEOs of what it is they're doing, and can meet and talk to each other. So with that, let's go to the next category. The next category is best mental and behavioral health company. So we define this as best mental digital health product or service for enabling better mental and behavioral health and wellness. Last year, we actually had two categories. We had one for mental health and one for behavioral health. And the reason we had two categories is we had so many applications. This is, if there's a fast growing area, it's definitely, in healthcare. I don't think anyone would question that this is the fastest growing area and the part of that is becoming core to healthcare. But we decided still to combine it this year into one category because we just couldn't see what the difference was between behavioral and mental health. So we had, again, sure, we had enough submissions for two companies, but we ended up with one. And mental health in the age of COVID, well, we've run webinars on this and everyone knows how important this all is. Mental health pre-COVID was already becoming, what was core, and it was moving from a supplemental part of healthcare to core coverage. As employers were increasingly covering and proactively, offering mental and behavioral health solutions, and they wanted to pay for it, and they wanted their payers to pay for it. Well, COVID hit, and in a sense, this sector, and I know as I'm an investor in this sector saw 3 years of acceleration in 1 year. And literally every pro forma that I saw, a 3-year pro forma, has been completed in the first year, because the need around COVID for new types of mental and behavioral health solutions was so paramount. And so this category, was on a roll this year. This category was super important. And Craig, I know you've got some other thoughts here.
Yeah, I think, listen, there was no solution for this before COVID. So this has not been solved even in standard medical, in the medical world to begin with. Most people who, take care of patients understand that we should probably have one mental health bed or one provider for mental health that one-to-one for mental health and medical needs. So the need here is truly acute. This couldn't be more important for the health of our country, for the health of each other. So I think if there's an area of certainly growth, but need, this really is one that jumps to the top of the list.
That's great. Well, here were our winners last year. Two truly great companies. Monroe, who's a local company, Monroe Health, who had a big blowout year this year, raised a lot more money. Congratulations. And Sana Health. Sana is based in Colorado, and Richard is probably the hardest working entrepreneur in the business. And he has a whole way to put goggles on and you get pain reliever, and it's an amazing product. So those were our winners last year. So this year, Craig, turn it over to you.
Happy to announce the winners for the quarterfinalists for this year. So number 1 is Cenovix, Tau, Silver Cloud, Taiatros, Sanvelo, Neuroflow, Ginger, Doctor on Demand. Shout out to my man Ian Tong if he's there. Big Health, Xfurl, Talkspace.
Congratulations. This was tough. This category, we had well over 100 applicants in this category. And again, it's congratulations, quarterfinalists. These are all mature. These are all available solutions. These are all solutions that you're seeing hospital systems around the country use, and you're going to hear more about them in the breakout rooms. So we're excited about that, and congratulations to you guys. Hats off. Okay, so this is a category that we're now calling, even though the banner here says Best COVID Mitigating Solution, we sort of realized that was an awfully crappy name. We're calling these 3 companies will win finals here, and we're calling these our COVID Patriots. And these are companies that really came around to built and have in market today solutions that are mitigating COVID. Of course, we would love to be honoring the vaccine companies and for their, the fact that that's all been solved. Well, it hasn't been solved, but thank God we have these solutions, in testing and pain mitigation and the like, doing the job to mitigate the impacts of the virus and what's going on in the world. So we basically describe this as the top 3 COVID response or COVID mitigating digital health solutions. Overwhelming number of apps. Well over 100 companies submitted their submissions for this. And what we're happy to announce also today is that at our awards final, Bob Wachter, who's our head of medicine at UCSF and is probably the most prolific blogger and tweeter on COVID in the country, is going to basically be hosting a separate event specifically on COVID, where we're going to be awarding these companies and bringing in a whole number of special guests to the show. So really excited that Bob has stepped up and is going to be running this part of the award session on the 23rd of September. So look, COVID changed everything. We all know that. And thank God we had you companies. At Health Hub alone, we ran panels on COVID. We created something called our UCSF Volunteer Patriots, where we matched 250 companies that were looking for specialists to help them get their product to market more quickly. Look, our world's changed, our kids' and parents' worlds have changed, and everything we're just too familiar with. But we're going to focus really on the positive here. And the positive here is we want to celebrate you guys. You guys basically came out, and we're celebrating the fact that thank God you guys were there, and you came out with solutions and companies to mitigate the impacts. And if you're making us all safer, you're making us all healthier, and you're making us all calmer. And you're going to see in the grand finale is that we're really going to be focusing so much on what you COVID mitigating companies have done, celebrating the greatness and the change, and the fact that everyone in the industry needs to really, really rally around you. And yes, COVID sucks, but at the same time, we've got you to basically mitigate it and make it suck less. What would you add to that, Craig?
I think when people think of technology companies, they think of companies that are creating value out of something that may or may not be there, the layperson. When we're talking about COVID mitigation, you guys are actually doing the work of saving people's lives, because it's clear that, however you fall on the spectrum, we haven't had a coordinated response in this country. So the work you guys are doing is life-saving. And I think it puts that should give you a point of pride, but also put emphasis on you guys really working hard to solve these problems, because people's lives are at stake. So be proud of that, but work diligently to get the solutions.
Great. Well, with that, let's Craig, get ready. Here we go.
All right. So last hurrah here. So Mammoth Biosciences, Conversa, Doctor on Demand, GoodRx, Echo, Color, Agenta, Blue Dot, Care Team, Big Health, Collective Health, Elemento Health, Gluco, OneHealth.io, Luma Health, Consejo Seno, Care Angel, Care Merge, Scanwell, Giant, Carbon Health, Blue Health Intelligence, Cuventus, Datos, Acela Biosystems.
Well, congratulations, guys. This is, you quarterfinalists were really, 1 out of, 13. And the companies that applied were all really good. I mean, really good. And it's just amazing what happened, you know, what a virus can do, and basically getting America thinking about how do we basically solve the problem. But hats off to you guys, and it's truly phenomenal. You're going to